As the NHS reels from Friday's cyber attack, there are new concerns over how it handles data, not in terms of security, but patient privacy. Sky News can exclusively reveal that Google DeepMind, the search giant's artificial intelligence arm, may have received the personally identifying medical records of 1.6 million NHS patients here at the Royal Free Hospital on a legally inappropriate basis. That's according to a letter sent by the National Data Guardian, Dame Fiona Caldicott. Well, this is the letter sent by the National Data Guardian, obtained exclusively by Sky News. And at the heart of it is the issue of consent, whether 1.6 million people really gave their permission for Royal Free to share their most sensitive medical information with Google. DeepMind, bought by Google in 2014, received the patient data to test an app called Streams, a healthcare platform to monitor patients for acute kidney injuries and rapidly inform clinicians. Nurses here have been using it for 8 weeks and praise its impact.
So just even today, I got an alert about 10 minutes ago to say somebody's creatinine was an acute kidney injury level 3, so 3 times above the baseline, and went to see her immediately. She's got a really high white cell count, which is a mark of infection. So we have stopped some medication, added some antibiotics, given some fluids, and we'll be monitoring her for the next 24-48 hours.
There are strict laws ensuring the confidentiality of NHS patients' data. Under common law, though, patients are implied to have consented to their information being shared if it was shared for the purpose of direct care. But in the letter, Dame Fiona wrote, "My considered opinion, therefore, remains that it would not have been within the reasonable expectation of patients that their records would have been shared for this purpose."
Well, I absolutely understand that patients would expect healthcare professionals and organisations to push the boundaries, to use new IT, to deliver patient benefits, to save lives, and to reduce complications. But I also understand that patients, and I'm a patient myself, expect their data to be treated with confidentiality. And we are absolutely committed at the Royal Free, as I think the health service is generally, to make sure that we get that interface and those boundaries right.
DeepMind itself is sensitive to patients' concerns.
So I think one thing that we do recognise that we could have done better is make sure that the public are really informed about how their data is used. I think it's a wide-scale concern across the NHS that we don't tell patients as well as we should how their sensitive data is used.
That's unlikely to assuage critics of the deal, though.
The way that this is developed has actually shown that they really made several fundamental errors at the beginning, and not fessing up to them and not dealing with them appropriately is really putting other projects and the public faith in data sharing deals, which have tremendous potential, in real peril.
It's possible there might be another legal basis for the data transfer. That's what the Information Commissioner's Office is looking at now. The conclusions of their investigation are expected soon. Tom Cheshire, Sky News.